Good afternoon and morning, everyone, and welcome to today's webinar, RTM for Pelvic Health Practice Success. My name is Joe, and I am the market manager at EverEx, and I'll be serving as your moderator for today's session. Pelvic health practices provide highly specialized, high-touch care, but much of a patient's progress depends on what happens between appointments. Today, we'll explore how remote therapeutic monitoring can help practices stay connected with patients, improve visibility into home exercise adherence and symptoms, and create a sustainable workflow without placing additional strain on clinicians. During today's sessions, we'll discuss what RTM is and how it fits into a pelvic health plan of care. We'll also cover which patients may be the strongest fit, how RTM can be introduced during the visit, and how practices can manage communication, documentation, billing, and clinician time. We'll also take a closer look at the experience of Wings Physiotherapy, including how they have incorporated RTM into their workflow and the enrollment, engagement, and adherence results it has seen so far. Please be sure to submit your questions throughout the presentation in the Q&A feature. We'll reserve time at the end of the session to answer as many questions as possible. With that, I'll hand it over to Emily to get us started.
So I'm Dr. Emily Reul. I own Wings Physiotherapy. We started back in 2019, one clinic. I was the solo clinician. And since then, we've been able to grow to two clinic locations, and we have 6 therapists on board now. We started working with EverEx almost 2 years ago to integrate RTM into our practice. And we'll talk a little bit later about how that's really helped us because we are an insurance-based clinic. I know a lot of pelvic health clinics are cash pay only, but the RTM has really helped us with decreasing payments, be able to continue to stay accepting insurance, but also be able to grow our practice to the 6 clinicians that we have now.
Thank you, Emily. And I'm Ellen Morello. I'm our president here at EverEx. I am a physical therapist. I've got about, almost a decade of experience kind of in the digital PT space. I've worked with a number of kind of digital musculoskeletal health startups, but really excited to be joined by Emily here to talk about some of the ways she's been implementing RTM in her practice. So we will be, this is kind of a quick overview again of what we'll be covering today. RTM specifically for pelvic health, how Emily's been kind of keeping patients engaged in between visits using RTM, how she's identified good patients for RTM and kind of what we're seeing for good fits for patient selection. How she, we're going to talk a little bit about how some of the workflow goes and kind of how that has helped with clinician time. And then we'll get into some of the data that we have from kind of Emily's time with EverEx. And then we'll have some time for Q&A. Emily, you've already done a pretty nice overview of kind of Wings and your practice, but anything else that you kind of wanted to add just about your specialty practice?
Yeah, I'll just say that RTM has really helped us kind of solve 2 problems. One is the reimbursement issues that I think all insurance-based PTs are facing, really probably all providers, but PTs especially. And then also the access issue that we have. The APTA actually a couple of weeks ago just came out with the State of Pelvic Health report. And one of the biggest takeaways from that was that the demand for pelvic health is way higher than what we're able to provide in terms of just access and, how many clinicians we have, payment, and all that kind of stuff. And so partnering with EverEx has really helped us to be able to increase our access while also kind of combating the reimbursement issues so that we can stay in business and keep our lights on and continue to be able to serve patients in the future.
Absolutely. That report was super interesting regarding the access limitations in particular. So it's a good read if anyone hasn't read it, but the APTA's State of Pelvic Health report. So I think, with an RTM program, so it's a home exercise program plus in some ways, right? So you're able to send the patient with their exercises to do at home. But you're able to track that information as well. So you're not just tracking adherence, did they complete their exercises, but you're also able to track some information about their symptoms. Um, you are able to do asynchronous messaging. So we have a secure messaging portal to message back and forth with patients, which is great for kind of some sensitive communication. Um, Solving the access limitations, we just touched on some of that, but that access to care is particularly hard for patients with pelvic health conditions. So adding RTM can help meet them where they're at and extend care beyond the clinic. It gives that continuity too. So, Emily, you've mentioned this before, but there's a lot of questions that come up between visits, and we have some of your messaging data later where we're talking about how much questions you get between visits, which so RTM is a tool to provide that continuity between visits, and it's a sustainable program too. So we will kind of touch on ways that Emily has built her practice around that. But anything you wanted to add here, Emily?
Yeah, I'll say on the continuity, I think it's really helped us with patient rapport too. In pelvic health, especially that rapport with your patient is super important. Not that we didn't have it before, but I think this has just kind of taken it to the next level because our patients know that they can ask us questions and do things in between visits. Access is an issue. And so we can't always see people even once a week. And so this gives them that touch point to be able to check in and see kind of what's going on. And then I'll just kind of mention on terms of the symptom tracking and the adherence. When we log in, we can kind of look at 4 different touch points for our patient. One, we can see did they do their exercises or not. When we onboard patients and we get them downloaded on the app, we do tell them like, I can see if you did your exercises. Like if you logged on and you ran through the videos or you logged on and you marked the exercises as done, I can see whether or not you did that. And I can't tell you how many patients come in for their follow-up appointment and they're like, oh, I did my exercises because I didn't want you to see that I wasn't doing anything. And so it's almost helped kind of motivate people a little bit. So that's kind of the first touch point. We can also see their symptoms. And so sometimes, especially in pelvic health, it's not, a linear, they start here with their pain and it goes down, in a linear fashion, it might be an up and down kind of thing. And so I can see if a patient, their baseline was maybe 3 out of 10, and now all of a sudden they've had 3 days in a row of 7 out of 10 pain. We can kind of check in between sessions and, troubleshoot with that patient what might be going on, what can they do. I've certainly had plenty of patients where we changed up their exercises based on what their symptom levels were in between visits. If they're doing good, we can progress. If they're not doing great, we can kind of regress and do maybe more of a symptom management until we can get back to a place where we can progress them again. So we get the symptom tracking. We also get if they have any difficulty with the exercises. So if some exercises are just too much, the patients actually have a way to star that. And then we can go in and change maybe just those specific exercises. But lastly, they can also just give us an overall score of like how easy or hard the exercises were. And so if I have a patient who is, saying that these exercises are a 1 out of 10 in terms of difficulty, as a PT, I know that we're probably not making the gains that we want to make. And so we can kind of modify it that way. Same thing on the other hand, if the patient's saying this is a 10 out of 10 in terms of how difficult this exercise program is, maybe I can dial it back a little bit so that we get kind of somewhere in the middle. And being able to kind of get that feedback in real time has been helpful. Instead of having the patient come in for their appointment, I'm asking them how their home exercise program is going. And then we spend the next 15 minutes of their 45-minute appointment going over their home exercise program. Now we can use that time to actually do some more stuff that might be helpful, hands-on work. We can progress exercises in the clinic and kind of do that way. So it's just given us a little bit more time too.
Yeah, absolutely. It's a great way to highlight all the ways to make the data actionable and impactful for the patient. So thank you for sharing that, like very tangible example. So at EverEx, we try to do things a little bit differently, especially for a specialty practice. We have a lot of ways that clients can request additions to our library. We have a lot of ways to enter custom notes based on you know, kind of feedback that you want the patient to see that are specific to that patient. Um, and then kind of, as Emily said, we have a way to kind of measure symptoms, not just pain, right? So it may be applicable to overall symptoms like urinary incontinence or something like that, as opposed to specifically a symptom of pain. So there's just a few things that we do to work with a specialty practice to make it fit. But Emily, anything you wanted to add in particular here about kind of the customization for
Yeah,
your.
I'll just kind of highlight how easy it's been to work with you guys to add new exercises. I think pelvic health is a little bit more diverse in terms of the exercises that we do. An outpatient ortho, you might get the same straight leg raise or bridges or whatever. And not that we don't use those. We also have a lot more specialty things. And then even within pelvic health, I think each pelvic health therapist has their own little flair or certain ways that they like to do exercises, or maybe exercises that, we don't even really have a great name for. And EverEx has been super helpful, and we send them those exercises. They get them filmed, they get them added to the app, and then it looks seamless. Because I've worked with other, app-based home exercise programs before, and they have these really nice, pretty looking videos. But then if you want to add your own exercise, we're having to take a picture of ourselves, we're having to upload it. It just doesn't look quite as nice visually. And so it's been really great to just be able to send them exercises. It's obviously not the next day that it gets added, but they get it added pretty quickly. And then we have this nice, visually appealing exercise instead of like, oh, here's all these great ones. And then, oh, here's the static picture of Emily doing this exercise. And what is she doing? Because they're all filmed in a very nice, studio. And so that's been really great to have that as an addition to the app so that we can really customize it to what our patients, what we want them to be doing.
Absolutely. And we will be doing kind of a sneak peek into the exercise library to show some of our content. So you'll be able to see that sort of professionally shot video quality. And then, as Emily said, though, there's always the ability to upload your own content too. So some clinics do really like having the ability to upload, whether it's patient education content or something specific that way. But the exercises can also be requested to be shot to fit into the kind of style. So for RTM, we aren't not going to do a super deep dive into kind of the CPT codes, but RTM, is a way to provide kind of care outside of the clinic, monitor patients, like we've been saying, track that adherence. But for a busy clinic, this provides the ability to bill. There are 6 CPT codes for RTM service in an outpatient practice that you can bill in addition to your normal CPT codes. These 6 codes allow you to generate up to potentially $300 in additional reimbursement for each patient episode. And the CPT codes, these 6 codes, they are billed on about a monthly cycle. Some run on a calendar month, some run on a 30-day cycle, depending on the type of codes. We can provide additional information on the CPT codes if billing is something that you do need a bit more education on. But we are trying to keep this webinar sort of more focused on the specialty practice and not go super deep on the RTM CPT codes. But that's some high level overview about what adding RTM can do for your practice. And Emily, maybe you want to speak to this a little bit too in terms of the impacts for your practice.
Yeah, without going into too much of, like you said, like the nitty-gritty detail of the codes and everything, I just want to highlight that RTM is really helping us as providers, I think, capture time that we were already spending with patients. They might be calling with questions. And I think this is especially applicable to pelvic health, just because those patients tend to be so complicated. If they're emailing me between sessions, or they're calling the clinic between sessions because they have questions, oh, I'm in a little bit more pain today, what do I do? This has kind of allowed us to be reimbursed for that time that we are spending with the patient. I think sometimes as PTs, we like to give our time and our expertise away for free, even though maybe we shouldn't. And this has kind of given us an avenue to be able to do that. And then kind of circling back to the business side of it, this has helped us stay afloat in an insurance-based model, in a specialty one-on-one care model, in an environment where payments just keep going, further down and down. Maybe 20 years ago, if I spent an extra 30 minutes a day interacting with patients, it wasn't a big deal because I was being fairly compensated for all the time that I saw them in person. But this helps us really to capture all of the time that we are spending with patients. Now, that's not to say we're just like logging on and doing nothing and just saying, okay, they did their exercises and moving on. That wouldn't really be what RTM is. But when we're actually engaging, we're modifying, we're providing that expertise, it's helping us be, compensated fairly for that.
Absolutely. Thank you so much for sharing all that. So for kind of setting patients up with RTM, it is really important to get the patient educated on what is involved in the program. Educated on the app, educated on kind of the style. Let them know that you are going to be watching what they're doing. You're going to be tracking their adherence. You're going to be able to see that. I think that accountability does drive engagement, and that would improve clinical outcomes. You'll be checking in over messaging. So, sometimes those check-ins are proactive. The therapist is saying, hey, how's it going at home? That's the reminder for the patient to come in and complete their program. Or the check-ins may be coming from the patient where they have specific questions about either their care plan or their symptoms. And then reinforcing the changes and adjusting the care plan. So based on what you are seeing, as Emily said, if exercises are being marked as difficult, if the patient's having pain or problems with anything, you're able to make those adjustments in real time instead of waiting a week to see the patient and kind of adjusting that care plan. Anything you wanted to add here,
Yeah,
Emily?
one thing I'll add is I think incorporating RTM and improving that access to us that patients have has kind of helped with patient drop off a little bit. Access, I think, as all public health providers know, we don't have enough time on our schedules. I might eval somebody and the next appointment might not be for 2 or 3 weeks, sometimes even more. And having that ability for us to kind of check in with them and see how their symptoms are day to day, how things are with their home exercise program, but also that they can message us with any questions has kind of helped, especially with those more complicated patients who maybe were just getting started with things after that first visit. Maybe they have a flare up of pain and then they start to think, oh, PT isn't working. PT just makes me feel worse. This allows us to see that and kind of check in with the patient and problem solve with them in between visits, instead of them just canceling their follow-up appointment that's in 3 weeks. Because improvement in pelvic health is not linear. And so it helps us kind of address that, but also get these patients the care that they need and check in and say, I know you're having a little bit more pain today. Here's what I want you to do. Instead of what we talked about, once we're feeling a little bit better, then we can kind of progress with what we talked about. And so we've seen less of those drop-offs with that. I think if it were a perfect world, patients could come back the next week and we could have that conversation in person and there would be no issues. But that's not the environment that we're working in. And if you look at that state of pelvic health report from APTA, I don't think that's going to change anytime soon. I think more patients and more providers are learning that pelvic health care or pelvic health PT is a thing and that they can access it and they can get help. But I don't think we're going to be able to keep up with that demand as a whole. I think as PT as a whole, we can't keep up with the demand for our patients right now, but then especially if we look at the subset of pelvic health PT.
Yeah, absolutely. It's really a good way to kind of relate it back to your population and building trust too, right? Like trust is super important for, especially this population where you're talking about sensitive topics. You're able to kind of build that trust and know that, you're along for the journey of their care.
Yeah, and I think patients kind of appreciate when we are checking in because it's showing that we're like putting effort into them and we actually care about their well-being. I'm not just seeing them in clinic, giving them a piece of paper, sending them on their way and, not following up at all after that. And I think it gives them a sense of like, oh, this person actually does care about me and whether or not I get better, which gets us better buy-in and better rapport. And I think we all know better rapport for the most part equals better outcomes for our patients too.
Absolutely. Well, I think that that's a great kind of segue into thinking about like patients that are a good fit for RTM versus patients that maybe aren't as good of a fit for RTM. So the patients that do really well on RTM are the ones that maybe are a little bit more technically savvy, able to kind of engage with an app, but as Emily was saying too, those patients that maybe aren't coming in as frequently, who do need that care support at home, this is a great way to kind of stay connected to those patients who do really need that exercise at home to be successful. And bridging those gaps, like those patients are great for RTM. And then kind of more tangibly or more tactically for implementation though, to get a patient set up successfully, it is really important to I think setting them up at the beginning of care and setting that expectation of, hey, this is kind of part of your care. It's an option for you. You can do these, standalone exercises on a PDF, or you can have this kind of extension of care. And this program will be our way to kind of stay in touch between visits, our way to kind of get you involved in your care plan at home, and I will be monitoring them. And then making sure that the patient is set up before they leave the clinic is also a really good success tip because you can make sure they know how to use the app, they know how to access everything, and that you are their resource in this app, I think really builds that like, hey, you have access to me here, and you're all set up and ready to go here on your app. And then setting those expectations with the patient. I do expect, you to complete your exercises here because I will be able to see them. I do expect, you can message me with questions. I will be looking at if you are marking anything difficult so I can adjust accordingly. And letting the patient know all of those things so that they are like, okay, this is where I go for my care plan at home. Um, Anything to add here, Emily?
Yeah, I'll just give a little insight into kind of how we operate. So, at the first visit, we give patients an option. We have this app, we can customize all the exercises to you. I typically have the app on my phone and I'll just show them this is what it looks like. I would say overwhelmingly, most of our patients are like, yes, I want the app. That's really cool. I think it works really well for two sets of people. One, people who are busy. That could be because they're a mom, it could be because they're working a lot, but just the patient who doesn't want or doesn't have the mental capacity to have kind of one more cognitive task to think about. They just want to open the app, hit play, follow the instructions. It's really great that the app even counts for them. So if it's a stretch, it will count however many seconds I put in that I want them to hold it. Even if it's a repetition-based exercise, it will count the reps. I've had a lot of patients too who say like, oh, I didn't realize how slow I was supposed to do the reps. Like, they're just throwing their leg up and down in the air if they're doing it at home on their own. But when they're following along with the app, they're like, wow, I felt it a lot more because I was going slowly with the app. And so that's been great. The other subset of people that I think it's been super helpful for is just the older population. There's obviously a subset of them who technology is not their friend, and those patients a lot of times will elect for, a PDF or a paper printout, and that's fine. But those are typically the patients who struggle with like our online intake paperwork and things like that. There's also another subset of older population who just like to have that visual and that video and audio kind of feedback as they're doing the exercises, because they look at the PDF sometimes and it just doesn't necessarily make sense, or they don't remember exactly what we did versus the app is actually showing you a video of somebody going through that exercise. And so they find that really helpful.
Yeah, absolutely. As a clinician, it's nice knowing my patient's not going to mess this up, right? Because it's so easy for them to follow along. They just have to press play. They're not going to, you know, go rogue on
Yeah.
on the program.
Because I know we've all had the patients where we give them an exercise, we do it with them in the clinic, and then we come back and they have a question about it. And I say, okay, let's see you do it. And you're like, I'm not sure how we got from point A to point B, but let's backtrack. They at least have that visual in between sessions. So they're not kind of, over a week or 2 weeks until we see them again. They're not doing it wrong and just kind of reinforcing that bad exercise or that bad, motor control that we're trying to avoid.
Absolutely. Yes. I think you made a very good point about like, some of the eccentrics or the slower movements where the movement quality is so important. So,
Yeah.
okay, well, we are gonna switch gears to kind of show you some of our software and our pelvic floor exercises in particular. Um, we do have a pretty robust exercise library, over 2,000 exercises. We have a way to filter through the library for pelvic floor in particular. Um, and then, as Emily was saying, the patient app, it shows a, professionally shot image of someone performing the exercise with the exact sets, reps, and hold time that is prescribed being demonstrated in the video. So taking some of the guesswork out. And then the app is kind of giving them that encouragement, giving them reminders, tracking milestones, encouraging that home exercise program completion. So I am going to just exit out of the full screen for a second and then switch over to our EverEx software. Is this okay? And so in the exercise library, over 2,000 exercises here, but there are ways to filter the entire program based on body region or uh, there's several ways to filter the program. I'm going to go ahead and find the, I'm going to go by body region actually. And I think we have, um, oh yeah, we can do it by muscle actually. And then I'm going to go to neck and trunk. And then we have lumbar and pelvis, uh, pelvic floor right there. And then, so these are all exercises that we have tagged as pelvic floor. Um, the therapist can go ahead and pick a few. Um, you can star ones that you use quite a bit, star some favorites. You can create your own programs too. So let's say, hey, for patients, with this diagnosis, I tend to prescribe these 10 exercises. So you can create those and build them into a custom program. We do have condition specific preset programs too, or you can upload your own content as well. Then, okay, I'm gonna add that one too, just so you can see. But then you can go through the exercises you've prescribed and adjust those sets and reps and hold times here. You can add a custom note. So let's say you're here and you want to add a custom note. Remember to breathe during this exercise. If you know the patient in particular has a difficulty remembering to breathe and holding their breath during that exercise, or whatever custom kind of feedback you want to give to the patient. You can change the sidedness of the exercise. And let's say, now I wanted them to do 15 reps of that. And then the program would adjust accordingly to match to what is prescribed by the clinician. So just kind of a quick overview of, some of the pelvic floor exercises we have in particular and some of the customization that you can create as a clinician to prescribe a custom program.
Can I point out one of my favorite features that you guys have
What
on
is it?
there? It's the adding, like if I have it on one side, just duplicating it for the
Hmm.
other side. Some of the other HEP programs that I've used, like I have to go in and click 5 different boxes to say, do this, this many sets, this many reps, this much hold time, this much rest time, do it this many times a day. And so it's really nice that I can just do, if I want them to do a straight leg raise, 3 sets of 15, I can do that, but then just hit that button, it'll duplicate the same thing for the left side. I know it's only saving me like a second or two, but if I'm doing this for tons of patients, it's saving me a lot of time in the long run.
Absolutely. Couldn't agree more. I think it should be that easy. But just to demonstrate that again, let's say I have it here set to left. I'm going to copy it and then I can set it to right. And it's that simple to just add the same exercise for both sides. We also have this request an exercise feature too. So let's say you really cannot find the exercise that you are looking for. You can request it, and our team will review that and see if we are missing something. We will add it to the library.
Another thing I'll point out that I think EverEx does a little bit better than some of the other HEP things we've worked with is when you search for something, it will give you options that are similar. I can't necessarily think of an example off the top of my head, but one of the other HEP programs that we've used, if you didn't type in the exercise like word for word what it wasn't going to pull up that result. And so if I type in, hip adduction, it's going to show me that versus if the other app, you might, if it was a hip adductor stretch instead of adduction, it wasn't going to give you that result. But I think EverEx does a much better job than some of the other ones of showing you everything so that you don't have to necessarily memorize the name of the exercise in the software. You just kind of have to tell it about what you're looking for, and it's a lot easier to find it that way.
Yeah, absolutely. And then you can star things too. Like if, this is the one that you love, you can star it, and then every time you click on the star, it will show you which ones you've highlighted. All right. I am going to switch gears back to our presentation here. And I would love, Emily, if you could share a little bit too about what adding RTM has kind of done for your practice workflows and just kind of your clinic growth overall. I think that would be super helpful for the audience to hear.
So I think anybody in pelvic health knows that, we see our patients one-on-one. And so when a patient cancels or even a patient no-shows their appointment, it really can cut a big dent into our day, especially for us. We do 90-minute evals with patients. And so if a patient doesn't show up or they cancel at the last minute and we can't fill that spot, I'm now paying my therapist 90 minutes of time where they're not really, or previously they weren't really able to do anything productive. Bringing RTM on has helped us kind of utilize that time a little bit better because it's not time that you can plan for necessarily. But we have a late cancellation or a no-show. Now the therapist can spend their time interacting with all of their other patients who are very engaged, answering their questions, improving access to care, giving high quality care. And then on the business side of it, it's also given us an opportunity to kind of make up for some of that missed revenue that we weren't getting because the patient no-showed or canceled on us. And so that's been super helpful. Again, we all know payment is not a great scene right now. And so it's just kind of helped combat that a little bit. It's also helped our practice grow a little bit. So when we started with EverEx, I think there was only two. It was myself and another therapist. And in that time, we've actually been able to grow to 6 clinicians now. One of those clinicians is somebody who works remotely with us. She's a pelvic health therapist, but she can help with RTM. So there are days when all of our patients do show up. And so she can help kind of review, check in with patients. She's a pelvic health specialist, so that helps, she's got that clinical background. But it's also helped us improve access to care because we've been able to create kind of a hybrid position where she's tracking RTM. She's actually helping with a lot of the back end stuff, in terms of billing. She helps, at the end of the month, she'll run a report and see who we are billing. And then she can actually go into that patient chart and write a note for them so that we can have something documented. And she's a licensed PT. So, she can actually sign a record in the chart. But she's also been able to start doing some telehealth appointments with us to, again, improve access to care. If we evaluate somebody and we can't get them in for another 4 or 5 weeks for their first follow-up, we can schedule a telehealth appointment with her. They can, one, get some, interventions from her, but then they also get to know her so that when she's interacting with them via the app for RTM, they know who they're talking to. And so that's been really cool because like we've already said many times before, access to care is not good and it's just going to continue to get worse, I think, in the near future. So this has been a really cool way to help us kind of think, I think, outside of the box to be able to serve as many patients as possible, especially in this insurance-based model, to just, have everybody have nice, strong, healthy, pain-free pelvic floors.
It's such a great, business case for hybrid care and expanding access. So I think what you've done with your practice and the growth there is really innovative and good business and helps give patients the access that they need.
Yeah, and I will say it's not just because she is remote, she's not
Mhm.
just somebody who has like no touch points. We'll have, team meetings or she'll meet one-on-one with a therapist for maybe 30 minutes or so to kind of check in and get updates on who the patients are so that there's not kind of a communication gap. But it's just really helped overall improve access. Patients are happier because they're not waiting tons of time in between their appointments. And then they're just kind of getting that individualized attention that I think a lot of patients just want. I think that's half the battle in PT and especially pelvic health is just helping patients feel heard and seen. And this has kind of helped us so that also my clinicians aren't burning out because we're just trying to fill, and see as many appointment times as possible per day.
Absolutely. That's super important. I know the burnout challenge is one that we hear a lot. So it's nice that this has been a component for you to reduce that as opposed to add to the burnout.
Yeah, and I think for my clinicians, it helps a little bit because we count any RTM time that they spend as part of their productivity
Mm.
time.
Hmm.
As an employer, I like to think we have a pretty generous productivity standard. But I think we all know there's days where patients cancel or everybody is sick or, it's a holiday or, whatever the case may be. There's just days that absolutely fall apart. And so this is a good way for the clinicians to not stress like, oh my goodness, my schedule's falling apart. What am I going to do? To just kind of fill some of that time.
Absolutely. Yep. And stay productive. Love it.
Because
Okay.
we don't like it. It's a business at the end of the day. We have to bring in money or we can't we can't keep our doors open.
100%. Yeah. Um, So this is a little bit of a snapshot of some of the data we've pulled on kind of the RTM program at Wings. In the course of the 2 years, almost 2 years we've been working together. Emily's registered about 200 patients at her clinic. Currently, there are 200 active RTM episodes going on. On average, these episodes of care are about 93, which sounds about average for an episode of care. But the 58 minutes of almost an hour of monitoring time that as Emily said, now this time that her clinicians would have been spending anyways engaging with patients at home, now that's billable time, and I think that is very meaningful in terms of being able to actually capture how much time is going into uh, you know, providing the home exercises and updating the plans and communicating with patients and reviewing the data. Um, all things you'd be doing kind of anyways, but now you're able to capture it and bill for that. Um, we also know exercise completion at home is always not always great in PT. So she's also seeing some good engagement in terms of exercise adherence at 75%.
And I
Um,
think a large part of that is because patients know that we can see whether or not they're doing it. And there's just, I don't know. I think deep down that feeling of like, I don't want to let somebody else down. And so we do them anyways. And that's great because when they do that, they get a lot better, a lot quicker.
Yeah, absolutely. No, I think accountability. It,
Yeah.
it does drive behavior change for sure. Anything else you wanted to add on this, Emily?
I guess I would just highlight, so in terms of the billing aspect, if we have 22 active RTM episodes and we're getting about $300 over, the length of their care plan, that's an extra just for those patients alone. Correct me if my math is wrong, but like an extra $6,000 just from those patients. And that's obviously just a small snapshot. If you think about over the course of the year, how much revenue we're adding to the practice, which again, just kind of helps combat, when Medicare cuts things 3% every year or however much they do it year to year, it kind of helps us with whenever that happens to kind of mitigate that.
Absolutely. No, I think that's really tangible, and super, helpful to bring it back to, and probably helps you, pay for that remote staff that, yeah, is providing additional access to care.
Yeah.
So really important as a practice owner. I love this metric here because, over 1,500 messages were exchanged between Wings staff and patients in this time. And I think, right, like as you said, that's time, that's effort that you probably would be spending to some extent anyways. Now you're capturing that time, but you're also giving patients access to that expertise, to the ability to ask you those questions at home when a concern arises. Um, and all of the check-ins that are occurring, right? That is just super meaningful, I think.
Yeah.
Um, all right. Well, we do have some time here for Q&A. I am gonna switch off my screen share here, so that we can go over to the Q&A portion.
Alrighty. Well, first and foremost, thank you, Emily and Ellen, for the wonderful presentation and walking us through what RTM can look like within a pelvic health practice and sharing both the clinical and operational sides. We'll be now moving into our live Q&A. So if you have a question, please include it in the Q&A section. For our first question, Emily, looking back at your experience before and after implementing EverEx, how has the platform impacted your patients, your clinical team, and the overall operation of Wings Physiotherapy?
Yeah, I think it's just been a really good addition to the care that we provide to patients, kind of touching on what we already talked about before. I think a big part of that is just that access to us that patients feel that they have. They feel a lot more connected, they feel seen, they feel heard. And then on the business side of it, we're also not just spending all of this time returning phone calls and things like that. And so I think it's just helped us overall provide better quality care to our patients by being able to have those touch points with them. Patients might be having tons of appointments or, just things that they want to tell us. And prior to implementing RTM, it was either I was spending lots of time on the phone or emailing them in between visits, or they were coming in for their first appointment and spending the first 20 minutes updating me on what had happened in between our last session. And so this is a nice way for them to kind of update me as things go, one, so that they don't feel so overwhelmed, but two, so that we're not having to just spend a whole bunch of time on updates. We can just get to what we need to do in the clinic when they come in. And I think, again, that circles back to that better care that we're able to provide for our patients.
For another public health practice considering RTM, how would you describe the value that it has brought to your clinic?
Um, I feel like it's hard to, put a value on it. I think it's solved two problems basically for us. One is that access to care issue, or maybe it hasn't solved it, but it's certainly helped with it. And then the second thing is it's just helped us kind of continue to make pelvic health accessible for everybody. That's kind of been our goal since we opened. That's why I chose not to do a cash pay practice, because I wanted people to have access to pelvic health, and the cash pay model is just not accessible for everybody. And so this has really helped us to be able to provide that, because we are getting a little bit more revenue for services that we're already providing for patients, but while also being able to stay in business.
We do have a question from Evelyn, and they are currently wondering, how was the process implementing RTM with your clinicians? Was there any pushback on clinicians, and how did you address this? Did you see anyone go from, I don't know about this, to, oh, this is adding value?
Yeah, I don't know that we really had much pushback. I mean, I think part of it is because we're already prescribing home exercise programs. It was kind of like, this is just a new way that we're going to do it. And then I think it's really helped that we get good patient buy-in. I mean, almost always when we offer patients, do you want the PDF or do you want the app? Patients are always like, oh, the app, I really like that. That sounds really cool. I really like this. And so I think it hasn't been too hard on the clinicians because the patients are also excited about it. And I think EverEx is also very user-friendly. It's easy to learn how to use. It's easy to kind of integrate it into your workflow. And so that's probably helped also.
You discussed the importance of selecting the right patients for RTM. What characteristics tell you that a pelvic health patient will benefit from this type of between visit support, and how do you introduce it as part of their care plan?
Yeah, so I think honestly, most patients I think benefit from it. It's just those patients who maybe technology skills are not all that great, I think are the only ones who don't. We're explaining to patients that this is their home exercise program. This is how they're going to get better. If you come to the clinic, once a week or once every few weeks, and that's the only time that we're kind of participating in your care, then we're probably not going to see a whole lot of progress. I usually like to compare it to going to the gym. Like if I go to the gym once, great, that's a good start, but I'm not going to see long-term benefits from that. Our home exercise program works just the same. And so if you are interacting with the app, I can see we can progress or regress as needed, but also just knowing that I can see that you're doing it and that accountability aspect has really helped patients to kind of buy into it and be, willing to perform their home exercise program.
One very notable component of the presentation was that you had shown that Wings Physiotherapy uses openings from cancellations as productive RTM time. What does your team typically accomplish during one of those blocks?
So they first would just address any patient messages that they have received. I think that's probably the top priority. It gives them time to answer those. But then it also just gives them time to go through and look. One of the nice things about EverEx is it will flag patients for us. So if a patient hasn't been active in their home exercise program, I forget what the, threshold is, but we can pull up a report. And if a patient hasn't engaged in, I don't know, I'm just going to make up a number, 5 days, the clinician can then reach out to them and say, hey, I see that you haven't done your exercises in 5 days. Is everything okay? And it kind of just opens that dialogue between the therapist and the patient. Sometimes the patient says, hey, I've been really busy. I've been on vacation. Maybe we modify it then and give them, okay, here, I'm just going to give you 2 exercises that I want you to focus on. I know you're on vacation, but let's take 5 minutes out of your day to do these. Or it gives them the chance. Maybe the patient says that the exercises weren't working or they had a question or whatever, but it just kind of opens that dialogue so that the therapist and the patient can problem solve together.
One concern clinic owners may have is that RTM could create additional work for an already busy team, as we know. What does a sustainable RTM workflow look like?
Yeah, this was probably one of the things that there was just kind of a learning curve with bringing on RTM, but I think working with you guys has been super helpful. One of the things was patients not downloading the app. And so then we were spending time calling them in between sessions, just, hey, I can see you haven't started the episode of care yet. And so getting advice from you guys just in terms of, just onboard the patient while they're there in the clinic. And then we see a lot more adherence to it. That's been helpful. But I think within each individual clinic, just figuring out kind of what does work for your workflow. We started out with just a few patients with RTM just to kind of see how things worked. But it's also been helpful that we were able to bring on that extra therapist to help us monitor and do all of that stuff as well. And because we're getting reimbursed for it, we can actually pay her. It's not, an extra expense. We're actually profiting off of having an extra clinician.
And that appears to be our final question. Thank you, Emily and Ellen, for sharing your experience, insights, and practical recommendations with us today. And thank you to the audience for attending. Today's conversation had showed that RTM is not only about adding technology, it is about creating a more consistent connection with patients between visits, gaining greater visibility into the adherence and progress, and developing a workflow that supports both patient care and practice sustainability. With that being said, thank you again and have a great rest of your day, everyone.